This is something. I hope me not lick nobody off. Hold on, me regal beagle. Me I lick people off.
Well, hello, all people joining us live. Yes. Oh, let me change my glasses and put on my good proper glasses.
No.
But these ones kind of go with my shirt, so I figured that I would just fool around with it a little bit. But let me change it.
So hold on there. Let me ask you something. You wear the glasses thinking that this is how you feel?
Well, the glasses, I wanted to take a dim view of the education sector. I feel like the whole education system gone blind to reason, logic, and everything. And as a member of this industry myself, I figure, well, we're all blind man leading blind, so we're all.
I tend not to I was looking at it today. I was looking at it from an emotional standpoint. I was looking at the decision from not political, but from an economical and also crime perspective, right?
Yes.
All right, so I was looking at it in the sense that we've had 2 years of no movement pretty much in the education system.
Yes.
We've had over at least 35% of our students untouched for the past 2 years. They don't get no kind of instructions at all.
And it's more than that. Yes.
And it's more than that, right? Yeah.
Yes.
And so it means that all of the fifth formers and fourth formers are transitioning out into the workplace. Some of them have not been touched. Some of them, even if them get touched, they get touched the right ways. I saw them trying to come back with some C-sex and da. But I'm looking at it in the sense that here we are trying to capture some unattached youth, to bring them back into the fold, to get a hold of them so that they don't go into becoming criminals and becoming a menace to society. And so give them an opportunity to come back into school and gain what they've lost in the past couple of years. Now, I see that as a plus because we are trying to help with a situation that we don't want to go back.
All right. I'm happy that you see it from that perspective. I certainly don't share your sentiment. This declaration that all schools must refrain from a fifth form graduation of student population and everybody must go to sixth form represents for me an added challenge to an existing handicap that we have in the education sector. So those 40% that you referenced who would not have been reached over the past 2 years, what you really need for them is some remedial action, not a forced continued education. You need to be saying, let us pause.
You're gone blank. Me not hear you. See you
Oh, you mean you're gone blank?
Me not hear you. What happened?
You need to fix your speaker. I am hearing you well.
No cuss me because you just chip out. I'm not nothing to do with what me do.
Okay, so you're hearing me now?
You just chip out like so.
It's Jamaica, me at you know why we don't know, so we don't have no good. This is what affect the people that present, which is online.
Please smile. The people that listen to you, okay?
Hello, people. Welcome to the show tonight.
Yeah, I hear you. You have to go come off. I don't know if I have to go come off and come back. But I hear you. Whatever you did a while ago, I don't know if it's me. Let me see if I turn me off and turn it back on. Hold on. Hello. Can you hear me?
Yes, so it must be my internet. I don't know.
Oh, but I can.
My internet is unstable.
It says your internet is unstable?
Yes.
But as soon as I turn off my thing, I want people to hear you. Let me go and talk. Let me see if they are here. Let me see if they are here.
Hello, good evening from Jamaica. Yes, I am having internet challenges here in this developing country of mine. Yet our education department expects all children to be online and
stop cussing people, man.
Okay, are you hearing me?
Yes.
I'm not cussing. I'm sharing my emotions with my friends and my colleagues. How would you feel about this 4-6 form? I have a problem with it. There's some students who after 5th form, they've had enough and they need to go on to something else. There's some who just not cut out for a traditional 6th form and them don't want to do an occupational study program. They want to start them university life. You're saying that those students who we regard as bright and brilliant must continue for 2 more years?
Those the government is trying to keep crime down. That's the whole idea.
Oh, you keep crime down by keeping them in school? So I'm to count them out, the 14-year-old who committing crime and the 15-year-old, them of school age and them still committing crime? Duh.
I'm telling you that is what is going on. I'm not asking you. This is a post-pandemic strategy to keep crime down and to bring the remediation back out of whack. Okay, we want to bring the students them who need remedial work to bring them up 2 or 3 or so grades, because that's the problem. I know that's what the problem is. I know that, and it might just be temporary too. It might, this thing might just be temporary to cover the temporary.
People. The declaration from the minister is that it's a 7-year school now. High school is 7 years. 1 through to 5th form and 2 years of 6th form, and it is in compulsory, so no graduation for 5th formers. And it just like bloop, as of now, no 5th form graduation. So all them people who was planning to go off to college to get a little jump start on them education, or even those who just not cut out for tertiary and academics in that kind of way, what do? They're forced to continue.
Well, I think that to me, what my understanding was, was that the second 2 years, what am I saying? What kind of full statement that? The 2 years that I add on is to mostly satisfy the students who are vocational oriented, who are technically oriented, that they can use those 2 years to build a business, to build the expertise and stuff for being a mechanic, being an engineer, whatever.
But them could have go get that any which way the system.
No, they can't get it.
Oh, you mean they can't get it? Where how them getting it now? The heart and all them other places they offer the training. Let me ask you. So I want to be a mechanic, and you going to Immaculate and you want to be a mechanic. You see them have no mechanic up there.
You have a choice now to leave. Immaculate and go to
Jamaica College.
Yeah, something like that. Okay. But the only problem, let me tell you, the only problem with this is that they just run out the community college out of business. Because the community college would have get the extra 2 years after high school. They just run them out of business completely.
Let me tell you, it's not a matter of running community colleges or tertiary institutions. For me, it's not allowing people a choice. It's not allowing me a fair choice as to what my child does, or allow my child to make a decision as to whether or not they want to spend up to age 18. Some children are bright enough and need to go again.
But I don't understand why you keep going away. I don't know why is it that you keep going away.
We're in a developing country and we don't have internet.
Is there internet? Can you hear me now?
Yes, I'm hearing you. I've never not heard you.
All right. So Diana, something nice happened today. And you just come on the show, come cuss out the people them, just like that. Something nice happened today, Elaine Thompson-Herah got the Athlete of the Year from the
But Leo, that's another news. She get it from the running race them the other day. She get it. So what kind of news that? From Olympic run, she get it. Anyhow, them never give her. Then that would have been another piece of quarrel tonight.
Oh my God! What she says? We're hearing her loud and clear. So my system, she said.
Exactly, and yeah, make me figure say because me in a one developing country sitting around with my little internet.
So why I accept it for? Why I accept the blame? She said.
Oh, for true, you said so. I know how you're miserable. I know how miserable with you and Michelle not there to defend me. Let me read the comments before the people say. So VM, what V mean? VN Heslop says,
Victor Mature.
Victor Mature Heslop says, good night and hope Michelle is well. Yes, Michelle is well. Cheryl Klein said, I can hear her. Leo, you need headphones. Everybody said, am I hear me? What do you? Patricia Band say, hello, everyone. Jean Wignall said, bless up yourself, everyone, in capital. So that's a loud, big up yourself.
May I hear you.
Carolyn Bonnick says, perhaps part of the reason that they want to keep students in school for sixth form is that children aged 15 or 16 are not emotionally equipped for tertiary education. Let me ask you something. What am I doing all this time? All those 15 and 16-year-olds. Maybe they need to consider job training for those students who don't want to go to continue the academic track and sixth form.
Can we start the show?
All right.
I mean, you just come on and just blast up the people. There's a show, it's a show. You know that, right? You start the show, man.
Hello, people. Good night. Welcome to 3 minus 1 limb tonight. But never mind. Minus 1 limb, we're still going. The other limb is doing well. And we're just so happy to be here to talk about the different activities in Jamaica, how they impact you and how they impact me, and how Leo views them. No, me and Leo don't look like we're going to get on tonight.
Well, we have some other things
coming up. The third time he's making me say, start the show. The third time he's saying to me, Dana, start the show. So I start the show again. Wanna beg me out, you know? Wanna give me my own show.
I want Prime Minister already. But anyway, so we have also Dr. Oneil Pyke coming on at 9:30. And he's going to be talking about men's health. He's going to be talking about tell your father and your uncle to come listen. We're talking about prostate issues.
All you men and boys come and listen. And ladies too, because we have to deal with them when they're sick.
Lad, yeah, we're going to talk about the effects of men's issue on women. We're going to talk about that too, right?
Well, let me tell you that prostate is a real issue for all of them. But I think somehow that men seem to make it bother them more than the women. We quite fine and move on with life. We just go shopping more. But they have a problem.
Listen, those are the things that I want to talk about. I want to talk about how do women, right, handle men who are having these issues. All right, because there are several kinds of men. Men who are.
What are the issues?
Men who are there are several men. There are men who don't want to talk about it. You can hear me good, right? You can hear me. Men who don't want to talk about it. Men who afraid of the whole issue. So them lockdown period. And there are men who don't mind talking about it or not mind dealing with it. And then there are men who don't mind talking about it. So that's 4 different kind of men. Men who like to talk, who can talk about it. Men who don't mind doing the right things. But then there's a men who don't want to even think about it. And then somebody think about it, then they don't want to know about it. Those are the men that are already. How do women deal with that?
What is it?
It.
What is it?
It, whatever prostate issues cause, it starts with E and it have one D at the second word.
Erectile dysfunction?
Yeah, never say it. I'm one of those. Right.
All right, so Leo wants for us to discuss how we as women manage or treat with men who don't want to talk about issues coming out of prostate cancer challenges, such as erectile dysfunction or reduced libido. I don't know what the concerns are. But I don't know. Simple for me is that if there's such an issue, then we don't have more time to go shopping. Duh.
Shopping? That's all you can talk about, shopping? What about the man? What about the man? The man. What about the man? No. The man is having a real issue. Listen. You know, I could see why men, in the 70s and 60s and 50s and well, that them want to take them life because them don't have the kind of, verve that they had before, right? And now them just go sit down and shop and play domino and become the best domino player, and then they wait until 11 o'clock, 12 o'clock at night come before they go home, and by the time 4 o'clock come up, they get up and go on a bar again, and so forth, right? I understand that issue. But now we have things like blue pill and red pill and brown pill. The money now
just take the pill them. So just take the pill them, see them.
Oh, so you don't have a problem with that?
So take the pill them.
You don't have a problem with that?
But half of the time we don't even know so we not take the pill. Keisha Powell says good night, everyone. Everybody can hear me. Howdy from rainy. Where is that? Look like England. Nice to see you both. Nice to see you too, Joan Richardson. I'm trying to move my thing around so that
I think Joan is in Bahamas or Barbados or one of those things.
Somewhere where should I rain or fall? It's not Barbados. Keisha Powell said, Leo, behave.
I am behaving. What is she talking about? I am behaving. Come on, Dr. Paul. Come on in. You're already here.
Say, hello, beautiful people. Hi, bestie. We have pills and toys too.
That's not the discussion that we want to have tonight. Okay, we want to talk about.
Dr. Oneil, turn on your video there. How you doing?
Hello.
Doing well, thank you.
I want to thank you for coming on because this woman is taking me on, and me not like how she take me on at all. You know,
to be honest with you, I'll tell you right now, Leo. Both of us can't take her on, so we might. I can't help you with that one.
You know, Dr. Pyke, I'm already liking you. I liked you before you came on, but right now you have just scored big time. Welcome. It is such a pleasure to have you again. And to talk about other matters. Well, let me ask you, what's that building in your background?
So that's Jackson North, the North campus in the Jackson Health System.
Okay, fabulous. And we don't have hospital that look like that, so I have to ask you these things when I see pictures.
Cornwall Regional Hospital, when you stay on a mountain and look up on a hill, you see a beautiful building.
You have a seat recently, you know, here it says still under construction.
Dr. Pyke, can you hear me?
Mm-hmm.
Still under construction. Ooh, drinking tea in a glass bottle. We don't have that out here.
Why? What happened? What happened to the glass bottle?
Fluid thing come in a plastic bottle.
Ooh.
Ouch. Yes. But we're not going to talk about that.
Dr. Pyke, tonight we have a lot of people waiting on us. Want to talk about the issues that affect men. And, you know, I didn't say this to you, and I wondered if I should have prepped you, but I didn't want to prep you. But there are some issues that men deal with. And the causes of these issues are from various places, right? For example, diabetes is one of those issues. What do you call it again? Prostate. Blood pressure is one of those. And the ultimate problem is, the ultimate direction, it goes right to that place where you urinate, right? You urinate from. That's where it goes. And it affects that thing there very hard. And I was telling her that back in the 70s and 60s and 50s and 40s, men used to take their life because them don't feel like them worth anything again. You know, they feel like once that is gone, then it might as well them dead. So then go sit on a street child and play domino until midnight or 2 o'clock in the morning, and then when them go in and go drop asleep, wake up in the morning and go back at the bar again, and women don't see them and think. That's the way they dealt with it in back in the days. So tell us, what is prostate? What is a prostate issue? What is the prostate first? What is the prostate? Tell me what that is.
So, the prostate is an organ that sits right at the bottom of the actual bladder. So the bladder, if you can, in terms of your urinary system, you have, most of us have 2 kidneys, not all of us actually, but most of us have 2 kidneys. And kidneys filter the blood and get out all the toxins and stuff, gets into the urine. And the urine now is stored in the bladder. And the bladder now connects to the urethra, which is in females, is obviously different, and in males come through the penis and such. So the prostate sits right at the bottom of the bladder. And so what happens, why men will have issues with urination, is that when the prostate enlarges, it actually kind of closes off the urinary flow. Now, the prostate actually is interesting because it should be considered in a larger context in terms of health. And so a lot of times men think about it in terms of that. Now, most of us men of any race, color, or creed will have some level of prostate enlargement throughout your life, and you'll have a higher risk as you get older of prostate cancer. Prostate cancer is quite a bit higher in Black males, and it's in terms of its incidence, and it's actually sometimes more virulent, more aggressive in Black males. So we have to be very conscious of that. But setting aside prostate cancer for a second, a lot of the things about the prostate health is really centered around the overall health. And so you have, hypertension prevails in our ethnicity, or among Black people. Diabetes also is very predominant among us, and those two things are major risk factors for having other problems that leads to erectile dysfunction. All right. And so even though some men might think of it as prostate and such, it's much more around hypertension that's poorly controlled, or diabetes that's poorly controlled, that leads to erectile dysfunction. As we age, at some point, it's not going to work anymore. And I think I hope that men have, and it will happen to all of us, Dana.
At some point, it become pointless.
It become pointless.
Dr. Pyke, there is a belief in Jamaica that the consumption of ackee contributes to this problem among men. Is it spurious, or is there any validity to it?
Boy, I hope so. I hope not, because
I love my ackee. Let me ask you that. Why is it that men are afraid of getting tested? Why is it that men are afraid to address the issue overall and outright? Why?
You know what? I think it's varied, but I think most of us, I think, fall in the category that if we don't know it, it's not present. And honestly, all of us, even us in the medical field who are well trained in the science of this, the art of it and everything, we also have that, and I have to fight it sometimes, because if you don't know, doesn't mean it's not present. Right. And so one of the things I would encourage men to understand is this. In this era of medicine, we have gotten so good in so many ways that many things that we can find early enough, we can usually either fix, or we can get it to a point where it's not going to actually either shorten your life or cause you untoward problems. And so that is the reason we should really stay with the primary care, get to your doctor, get checkups. And in men, that's just right now, as if, there are two major screenings that men have to go through. Now, the prostate, actually, for prostate cancer, we have gotten somewhat away from, the PSA as being a definitive thing. And it never really took hold 100%. But
what's a PSA? What's a PSA?
So the PSA stands for a prostate-specific antigen. And so what happens, it actually is elevated in men, in some men with prostate cancer. And so it's one of those markers, and it can still be used. It's still useful, but it's not the only thing that we should do. So
is that a blood test? It's a blood test.
It's a blood test. The rectal exam is still easily among the gold standard. That's what you have to do, and check the prostate, because we can do a rectal exam, and I know.
Doc, just tell us what a rectal exam is. Tell us, man, because them are listening. They're listening.
So the digital rectal exam, the digital rectal exam. Women go through this every year, and I don't know why men have such an issue with this in terms of having a pap smear and a pelvic, and that is much more intrusive than actually what we call the rectal exam.
So them Freddy.
Yes, and I must admit, I am among them. Then I'm pretty too. So don't trust too hard, because you know. But yes, we're true. We're afraid. As a matter of fact, I've always make a joke and say, if God knows why women bear children and go through that discomfort of having children, because if I saw Leo have a child and you see why him go through, there's no way I'm getting pregnant. I just trust that's not going to happen.
The funny thing about it is that women want to have children. How is that with that kind of being? What?
Well, the wonderment of women is that they're built differently than us, and it's a miracle of this universe that we complement each other so well in that way that we can actually keep the human race going on. But going back to the rectal exam, so the rectal exam is basically when we use a gloved finger and we actually palpate through the rectum the prostate gland. And that is one of the best ways to actually test it, because a trained clinician can tell the size of the prostate, if they feel any particular areas of the prostate that's not smooth and irregular, and you can actually tell from that if there's a problem. And if there's a problem, you will have to go on to having, in all likelihood, a biopsy. And a PSA, the prostate-specific antigen, is not a bad thing to actually have likewise, and especially for men who have other males in their family who've had this problem. I myself, my uncle, and had a similar problem. So I have to be very careful and mindful that at my age, over 50, I have to be very much getting that tested on a regular basis, yearly.
You start at 50 to do regular examinations, or should they start earlier than 50? What's the recommended age?
So the recommended age should be really in the early 40s, and it's not the same. For example, so one of the things about this is that if you have a family history of this, then you really ought to lean more into getting it started about 10 years prior to the youngest relative, if you will. So I think now the actual recommendation has changed a little bit over the years, but I still recommend that for my patients, that 10 years younger. And it's the same thing, for example, for colorectal cancer. And if you have family history of colorectal cancer, you want to start getting your colonoscopies much sooner. At one point we used to recommend age 50, now it's more 45. But if you have a strong family history, like a couple first degree relatives, like a mother or a sibling or a father who had colorectal cancer, you want to go 10 years younger than that and start your screenings then.
Okay.
Hey, Doc, I did some reading before I came on, and some of the questions that people are going to ask or want to ask, and we can look at the comments in a minute. They're asking symptoms of prostate issues, and I looked at things like you can't pee straight anymore; it flashes all over the place, or you're getting soft and you can't get it hard, and what else? There's something else I don't remember, but give us some examples here.
So I think the urinary, there are two things that I think is very predominant in most men. Is one, you have what's called urinary frequency, meaning that you end up going to the bathroom a lot and you find that you're not, you don't have a lot of urine coming out. That's one. So even though you're going frequently, you're not emptying your bladder properly.
Okay,
and so you constantly have, and sometimes you have what's called urgency, and urgency is when you have that urge to go, and you have to go like right now, kind of thing. And so it's those are two of the symptoms. And obviously when you go to bed at night and you're flat, a lot of the fluids that gather sometimes in the leg and elsewhere kind of gets all back in your bloodstream, and it causes you to actually want to go to the bathroom more often. So a lot of times men will find that they're getting up at night very often to go to the bathroom and urinate. Sometimes they have a full bladder and they're emptying, but a lot of times the stream is actually weaker, and you can feel it, and you can feel that the stream is weaker and it's actually not emptying as much. The other thing though is that you don't want to wait until this happens, but it sometimes men will come in and they have They actually have a full bladder and they literally cannot go. And we have.
Is that what they call stoppage of water?
Well, stoppage of water is definitely, this is the worst stoppage of water though, because stoppage of water means that you really can't, and that happens. I mean, I put a catheter in and drain the bladder. And that's when the prostate really gets large enough to block off the entire, and by the way, I won't bore you with the kind of medicines that can cause this, but a lot of different medicines can actually make it worse. And so you might be going along and you're fine, you might have mild symptoms, and you catch a cold or the doctor puts you on a blood pressure medicine or something like that, and it suddenly gets much worse. And that's a lot of times what we see is that it's kind of just trucking along for months and years, in fact, where it's just slowly getting worse. And then something happens and it gets dramatically different.
Wow. I want to ask something very juvenile, but what prevent women don't have prostate?
Correct.
Okay.
Women, you have enough problems.
He said that with a flat face.
All right, I just take, since we're breaking up, let me just read a few comments here.
Yes.
I have to get this gadget here. It says, based on my child's academic performance, I should be able to choose to keep her in high school, move her to a trade school or college. It should not be the government's choice. We're talking earlier about compulsory sixth form implemented here in Jamaica as of now. Peter Gay says, good night. Annette Kellner says, love it, talk up the things. Tess Walcott says, thing in a plastic bottle don't taste right. That's true.
I agree with that.
Lawton Watkinson says, what are some preventative measures that men can do to prevent this cancer?
Let me answer that question first.
So I tell you what, I am one of the physicians that if I am most successful when I can actually get my patients off of all medication. And there's some of the old scholars in medicine back way before our time. What they spoke of was how what you eat, what you consume will be the very medicine for your body, right? And so I personally believe in a plant-based diet, all right? Okay. And I do, I might have fish once in a while, but my basic diet is plants. I don't eat any pork. I don't eat any beef. I don't eat chicken. I don't eat anything like that. And believe me, this was not always. Okay. Came to this much later. I went through medical school. Bacon was one of my favorite things. But okay. I've always kind of embraced the idea that when you learn new things, in medical school, for example, and I did all my schooling up here. I finished high school at Cornwall in Jamaica, and then I came here, did another year of high school because I was quite young. And then I went to college and medical school. And in medical school, though, one of the things that they did not teach back 20 odd years ago when I went, almost 30 years now, they didn't really teach about nutrition. Everything that we learned was all geared about what I put into the category of secondary interventions. Okay. So the medications and the like, right, after things have gone wrong. But really what you put in your body is absolutely the number one thing. And I think that they're most, and you'll hear other people say, oh, I went on a keto diet and they lost a lot of weight. The weight is just a symptom of something else. It's not necessarily, that is not necessarily the end all be all. And yes, a healthy weight is definitely important, because even with this COVID crisis that we have experienced over the last 20 odd months, one of the absolute common things among most people who died of COVID was obesity. And so it's an independent risk factor that puts you in a bad category. So we know that, but it's not the only thing. The main thing that you want to do for prostate health, for your colon health, for your cardiovascular health, for your brain health is what you eat. And that's probably a whole different show, but it's a very important.
Okay. Yes, I'm not so sure I go on the show because Christmas I come, I can't go to the port.
Well, you're not at risk. You don't carry a prostate. Okay, so you can all the pork you want.
But there are other issues.
Other issues? Yes.
Go ahead and read some more.
Thank you so much for that. The preventative measures. Joan Richardson says, I live in Bermuda, which is located in the middle of the Atlantic, not the Caribbean. So she correcting whatever you said wrong, Leo. Lorna says, some men are afraid to do the rectal exam. They rather do the PSA. Beverly Brown says, Dr. Diana looks sexy, not flirting, just stating what I see. That's fine. A little flirting won't hurt. Joan says, what a great topic. I hope lots of men are tuned in. I shared with a few. Michelle Fanger says, great. No to pork. Michelle, go back to your bed. And it says, so true. Beverly Brown says, my dad's 93-year-old is experiencing a frequency problem. He's getting frustrated. What can I tell him to help him cope?
Yeah, he has to go see his doctor though. That's the number one thing, because it can be a fairly straightforward thing. And nowadays we have less invasive procedures that even for someone an advanced age of 93 can have done without too much problems, and I think that there are a number of things that, because no matter what age you are, I think one of the most important things is your quality of life. I mean, and I had a good friend actually just pass away, unfortunately. He's 36 years old, and of 36, young kid, bright kid, and of a brain cancer. And so it's not about length of life. I think you can still describe yourself as having a life well lived, irrespective of that duration. And if you are granted many years, you still want to actually stay focused on the quality, right, as you go along. And so even for a person who's 93, go see a doctor. There are a number of urologists who do very, little minimally invasive kind of interventions that can help. I think it's Joan's dad. So, that would be important.
I have a friend of mine, and I'm sorry. And he told me that, he felt this thing coming on where his urine getting slower and stuff. And he never paid any mind. And then one day he woke up and he wanted to use the bathroom. He wanted to go pee. And when he got the bathroom, nothing now come on. He said, Leo, that's the worst feeling I could ever have in my life. I wanted to pee and nothing at all was coming out. And they had to rush me to the hospital. And he said they took a catheter and put up there. He says, when it got released, man, he said, Jesus Christ, it never feels so good in my life. But he said, but it couldn't come out and he couldn't understand. Yeah. And so when they checked him, his PSA was over 4. I don't know what that means. And then the doctor said to him, he has to bring it back down. So, I spoke with him last week and he says, it's like 3.9 now and I feel a whole lot better. So tell me what does that mean? What all that mean?
Leo, this is a safe space. You can say it's okay, we're not going to judge you if you're having these challenges. This is a safe space.
What's she talking
about? Well, Leah, if you want me to actually explain what she's talking about.
Explain that to me.
but let's say this, I think that you said something that was really, really key though. Right. I think that's what most men need to hear. Your friend, whether the friend is a friend in quotes.
You know what? Anyway, go ahead.
So what the way you described it though was really key, because that's very typical of most men's experience, where it doesn't usually come on just all of a sudden you're peeing well and then you're not peeing well and you're not peeing at all. It's usually a gradual progression, and this is a key thing. You want to get your checkups very often. At least go and get your checkups, and don't be embarrassed about telling your doctor if for some reason you're not feeling comfortable with whoever doctor you have. Find another doctor. Find someone who can serve you, because as physicians, it's not about us. And to be brutally honest, I'll say it's about our profession. The entire profession of medicine has been too physician-centric. It's too centered around what we do. It's about the patient. It's about the person. And so you find someone who you can actually trust and listen to, and who listens to you. And that's key, because I think that most men, I think if you found someone who you can actually trust their word and speak confidently and know that you're speaking in confidence, that you will actually share more, because men need to share more of these symptoms early on, when it's actually a very simple kind of process in getting it better, and not progressing to that point where you're being rushed to the emergency room, because that's often the actual story. I had a good friend of mine that happened to a few weeks ago. Same exact scenario. And when I asked him, I said, man, why didn't you tell me that this was going on? We could have actually dealt with it. But he said, boy, I felt embarrassed about it and such, you know. But it's the stigma that's attached to that is overplayed, because, and it's overplayed because of this, Leo and Diana. Think about this. This is not gonna actually limit to certain men. It will happen to every single male. We are 20 and we are 25, we are 30 one time. And after that, things start slide hard. And then when it starts to slide, you have to actually respond to it, because you see some men in them 60s and even 70s still having a very healthy sex life. And there's a reason for that. Some of it is genetic, but other relates to how they cared for themselves when they were younger. So if there are men on listening now who are in their 30s especially, this is a time when you want to kind of adjust your lifestyle, because a lot of things that we do to ourselves. There's no reason anybody should be still smoking. Nobody. And I don't have any patience for anybody who says, well, it's hard. Okay, then go ahead. But we have all the answers to that. Same thing with the COVID vaccine. There's no reason for that anymore. We don't have any horns growing out of our heads. We have proven this over and over for those who have been vaccinated. Understand, we've been vaccinated by so many things since we're kids. I don't know why this happened right now that we're having this kind of issues. But this is very important for us to be preventative, rather than having this secondary stuff where after your lungs gone and your heart gone, you say, I'm going to stop smoke now. You might as well keep going.
Right.
You know?
Thank you very much for that. But what about those e-cigars and stuff? They seem to be very safe, but I don't want you to answer that just yet.
Yeah, let's not go there. Let's not go there.
Yes. Lawton Wilson says, how often should you have your PSA checked? And Hopewell says, what is PSA? So can you explain what is a PSA? What is the perfect PSA number? And also how often they should have a check?
Excellent. So the PSA is prostate specific antigen, and it's a
prostate
blood test.
Specific antigen. Okay.
And it's a blood test that kind of is measured, and it's the normal for it is there's a lab value that's normal, and usually like under 2 or so is normal, under even 4 or 5 in some assays. But the most important thing is a relative change. So you usually get your PSA checked, and it's a 1 or 2, and each year, and that's an annual check. Each year you see, and if there is actually an increase in it, that's one way of actually telling that there is something that might be going on. But it is no longer a recommended singular test in of itself. It is not enough to actually do that. The digital rectal exam that we spoke about earlier is an absolute necessity. And in fact, that is more important than the PSA. Okay, so that's very important.
Dr. Pyke, you said digital rectal exam. Does that mean that there is some gadget now that they're using to do the exam and not the finger?
Still the finger. And it's,
hold on to that. Mm-hmm. How do you get digital out of finger? Explain that for me.
A digit.
It's a digit.
I see.
Your digits.
Okay, I see.
1 digit, 2 digits. I usually use just 1 digit. And all right, so let me explain this to you. So it's very important though to realize that the finger though is such that you're feeling the contours of the prostate, and because the way the prostate sits, it sits right up against the rectum. And so you have the bladder, the prostate, all in that area. You can feel the prostate very easily with your finger. and you can feel if there's any abnormalities in the organ. So that's really important. So you can't replace that. Now there are many screening stuff, that the rectal exam can actually screen for, but that's the main one we use it for the most part.
All right, so let's say we have addressed the preventative measures, but let's say someone already has it. What is it that they need to do, and what's their course of action and that kind of stuff? That's important also.
I think that so if someone already has say prostate cancer, they've probably had either surgery or they've had some other treatment modalities. They have many, and we had different shows to actually go through all of them. But I think you have to lean on being your own advocate. So don't wait for things to actually go awful wrong before you actually seek attention. Try to seek attention often, and a lot of times now you don't have to go into the doctor. If one thing the last year and a half has showed us is that telemedicine, getting on and kind of interacting with the doctor, using the technology, whatever is available to you, and most of these different hospitals and health centers, they have some kind of means to communicate with your doctor or your nurse practitioner via, text or email or somewhere like that. If you have a question, reach out, because a lot of times, as I said earlier, we have these symptoms, we don't pay attention to it early enough until it gets to be much worse. And at that point, we are limited in the amount of and the kind of intervention that we can do to get you back to square.
Okay, so that's great, because I was going to ask you, once you have that surgery and they put the knife or the laser on you, right? What's the effects? Because I want to scare some men now, right? What's the follow-up effects of having a surgery? Do you lose it?
You can. On a serious note, and I think let me be very clear about one thing though, and I fully understand. I'm really likewise, but I think that in many ways, the one thing that as men we have defined ourselves by our sexuality way too much. Okay, we are much more than that.
Jamaican men.
We're not the Jamaican men alone. It's all across. Men. And so we shouldn't define ourselves that way in such a way. So we put so much emphasis on that if that's a problem, then all is lost. No, all is not lost. There's so much contribution that we can give to society as a large, and it's not just about that. That's a very important thing, and I'm not underplaying the importance of a healthy sex life as long as it's as possible. But the one thing that I want to make men know that is the way you treat your body when you are younger is what is the biggest thing that will determine not only your sex life, but your overall health when you're older. And so someone might say, I'm 40, I'm already old, or I'm 60, I'm already old. That's not true. That's not true. It's all a relative thing. So you want to actually, at any time you are convinced that you want to make a change, go ahead. The first thing you do is this. You limit, this year is just for the show, to be honest with you. I've had this in the fridge for the longest while. But I had to bring it out for the show. But you want to limit sodas. You want to limit cigarettes. You want to actually limit alcohol and excess. We know these things. We know it. And anybody who at this point say they don't know it, they've been living under a rock. But what a lot of people don't understand is when we say limited, what does that mean? So for example, cigarettes, none, zero, not one cigarette, not half a cigarette, not half a pack a week, no cigarettes, zero. There's no way that is actually something that you're treating your body like a temple. So when you actually, and that's why doctors are do so well, because most of the things we treat are things that are actually things that we cause on our own bodies, a lot of things. Because it's even compounded worse when you have a genetic predisposition, and on top of that, you're gonna make it worse and do other things. Just All
right, so we have some questions on YouTube. Marvet says, can erectile dysfunction be cured Alethea says, come on, guys, the digit is smaller than the baby.
All right. And also Hopewell says, these people are out of their mind. No finger. That's a big no, big no. Luton says, should you go on a fasting prior to getting your blood drawn for checking your PSA? Is it a good idea for a man to have a male doctor? And somebody has asked, do female doctors do these checks? Of course, the female doctor do this check, but not do it.
We just don't want Dan to do it. We just don't want Dan to do it.
No, so I'll share with you this. So my physician is female,
Yes.
my primary care, and absolutely. So again, you know, it's not, you know, you have to be comfortable with the person who you're going to. That's a number one thing. And once you're comfortable with that person, both their aptitude and their attitude, then you're good. You know, so that's fine. I think that the PSA, you don't usually have to fast for that. But you want to make sure that, you know, you usually do it in the context of other, with a lot of other blood tests when you're doing it anyway. So a lot of times the other ones, your cholesterol and such, your glucose, you want that to be fasting. So you just do it all together, usually first thing in the morning when you're doing the scar test. And it's just once a year, often,
The erectile dysfunction can be cured. Answer that.
It can be cured, absolutely, absolutely. And there's a whole bunch, but this is the thing. It really requires attention to the detail as it pertains to what caused it in the first place. So me saying that this is what cures it would not work. You have
could be a blood pressure, high blood pressure.
Absolutely, it could be a blood pressure, it could be diabetes, it could be a number of things. And you want to actually investigate what, and don't do this. This is what you don't do, okay? You don't start having symptoms of erectile dysfunction and you go borrow your friend Viagra.
Go check it out.
Don't do that. Don't do that.
By your own? Is that what you're suggesting?
No, go and get it checked out properly. Make sure you understand, because a lot of times you don't even need it. You don't need that. What you need is a proper solution to what's going on with your body. And the erectile dysfunction is just a symptom. It's just one small piece of what might be going on and brewing inside your body. So you want to get it checked out from head to toe and just trying to figure out what's going on.
All right, fair enough. There's a doctor in Jamaica, Dr. Fisher. She's somewhere in Montego Bay, who is big on these ED. She's a friend of mine, so I know of it. But she seemed to be having some measure of success with addressing ED dysfunction, the erectile dysfunction for men in Jamaica. VM says it's a good idea for a man to have, yes. Somebody says, hey doc, the internet turned some folks into scientists until they get COVID, and while hospitalized, ask them, ask, then beg to be vaccinated, but too late. It's all the misconceptions and views that people choose to spew out there. But again, you've stated, Dr. Pyke, that it is imperative for us to have good relationships with our general practitioners and to have a regimen that sees us having these men, particularly having their examinations, just like we, when we turn 40, or when we at least admit to being 40, we begin to have particular examinations done on an annual basis. Men need to get into that habit, and we need to grow our boys to, you know, like you say, the emphasis is not on your sexual powers, but on other things. There's so much more that you can do. So even if it is that you're having an ED challenge, there's much more, there's greater value to life than that. But I somehow think that a lot of men don't get it, that you can not function the way you did 20 years ago and still be loved and appreciated by your wife or your partner in the very same way, you know?
I was about to ask that question, Doc. What has been your experience with the wives of the husbands who have these difficulties with prostate issues and also ED? And I'm going to come back to diabetes and blood pressure later on, but I'd like you to, what has been your experience with the wives?
You know, so to be honest with you, I have not had a lot of experience with that part of it, because my practice is mostly in the critical care unit. So when patients are very sick, My experience is much more anecdotal, unfortunately, in that regard. So, you know, but overall, though, I think most wives, I find the husbands are much more, or the partners, the male partners are much more hard on themselves than the women will ever be. The women are going to be usually kind and patient and such. And I think that if most men engage with their spouses and really talk it through, a lot of times the women are going to be helpful in getting them and helping them to get to the right doctor and getting it checked out. The one thing that you have to remember, though, the men have to remember, is that you got to remove the stigma of this being your defining characteristic. It can't. We have to. And I have nephews. Myself, I only have daughters, but my nephews, I talk to them all the time, and I sit them down and I try to talk to them about, you know, don't define yourself by one aspect of you. It's not fair to you, and it's just not accurate at all. You know, you're going to actually contribute a lot more than just this idea that you are, you know, you're just built for sex. And don't get me wrong, I'm not downplaying it, because it's such an important part of our lives with regards to not only procreation, but actually enjoyment. Well,
there's another part. There's another part to that.
What's the other part?
Because the other part is men spend them lives, if them have ED, fretting that them going to get born. You understand? Because them can't perform. So that's the other part of it, that, you know, them most of them wife know, and them say, Jesus Christ, you know, when she gonna work, you know, you know, one young boy out the sort, you know, whatever. That's the other part. And a lot of men go to bed with that kind of thing on their mind.
And you know, that anybody can help them if that is if that is their challenge. Them have to take care of themselves. Them either shuffle up and lay down and wait, forget the bone, or go do something else.
You know, I tell you what, it's not really unique in that way, because a lot of times we fret about things that we can't really control. And the things that we can control, we don't really fret about, you know. So I think that it's the if a man is in a position where he's not comfortable in sharing with his wife exactly what's going on, just do yourself a favor, though. Get out there and go find someone and find a doctor and check it out yourself and find out. Because what I want men to understand is there's usually a reversible cause.
Yes.
But the longer you wait to actually investigate that cause, the less reversible it becomes. And that is the essence of why when you start having symptoms and it doesn't present itself, let's be honest, it's not like one day you are like a 25-year-old and the next day you're like, what is happening? You know, it's not like that. It's really an insidious thing. It kind of just creep upon you little by little. But at some point, it is unequivocal. It's not ambiguous anymore. That's something not quite right. At that point, go get it checked out. Because at that point, if you are actually prompt in getting it checked out, then you usually can find a reversible cause. And once you reverse that cause, you know, I'm not saying you're back to normal. And by the way, this is not to say that there's not a very good use for things like Viagra or Cialis or other things. It's just that you don't want to jump to that first. That might be an additive thing, because I have many of my friends who say that enhances their sex life and it enhances the experience for their female partners likewise. And that's very good. But you don't want to actually jump to that as being the first thing before you actually find out what's the underlying cause for this in the first place. Is it one of the reversible things, or is it just me getting older? Because as you get older, you're not going to be as vigorous. You're not going to be at a certain point. But I have 60-odd-year-old friends, and they might be lying, but if they claim that they're as good as they were when they were like, you know, 20.
I lie them a tell. Be sure I lie them a tell.
I lie them a tell.
But okay, so since we're going there, one of the things that two of the other things that we really haven't spent any time with, I know that the prostate is a factor, right? But also diabetes is one of those things, and high blood pressure. And I'd like you to spend some time with the persons who probably don't have a prostate issue, but have a blood pressure issue, or they have a diabetic issue because their mother and then father have it, and them not doing anything to reverse that kind of traditional stuff. Spend some time on those people.
Yeah, man. So in our among Black people, we do have, unfortunately, a lot of us are diabetic and hypertensive, right? And so they dealing with that diabetes first. Diabetes is one of the most dangerous diseases that we have plaguing us right now, because the effects of diabetes is just in every organ system, from your brain to your heart, to your kidneys, to your legs, the sensation in your legs, the nervous system, everything, right? And so what diabetes does, though, it can mimic some of the other things that we talk about with the prostate. So if you can imagine someone who is getting older and now having their blood, their blood sugar higher and higher and higher, and not getting tested, and having diabetes but not necessarily knowing about it, you're gonna have issues with your urinary flow, and how frequent you go and all that kind of stuff. And that can be a symptom likewise, and that might not anything be about the prostate. It might be just diabetes. And so you get your diabetes under control, and lo and behold, your symptoms of even erectile dysfunction goes away, or other dysfunction. Hypertension is the same thing. Hypertension is also one of the more dangerous things, because it's you have some people come in and their blood pressure is so high that they end up having, unfortunately, a stroke or something along that line. But a lot of times, hypertension affects you over the entirety of your life. So it's just high enough that it's not alarming, but it's high enough that it causes damage to the blood vessels, to the heart, to the kidney, and to different organs. And over time, over a span of say 20 years or 10 years or so of that happening, all your organ systems start to function in a suboptimal way. It's not quite there anymore. And so those are the two really dangerous things about both diabetes and hypertension, is that you want to get it under control, and it's controllable for the most part. And a lot of us will need not just one, but two, sometimes three medications. And this is the other part that's actually really important to state here. Some of the medicines, especially for blood pressure, for men, causes some symptoms similar to erectile dysfunction. Okay. And so it's really important for men to actually be upfront and get back to their doctor and say, hey, listen, I'm taking this medicine, and I can't have a proper erection anymore, and I'm not sure what's going on. And this is actually understandable. It's somewhat expected in at least a percentage of males. And so on a level, the person have to be very much proactive to say that if something starts happening, the one thing you should not do is just cold turkey stop taking the medicine.
Right.
Because that can have bad problems too. So you want to get back to your doctor and say, hey, listen, I need an alternative. And there will be alternatives. So that's important. And
then the worst thing that can happen is if you have both diabetes and hypertension. And that's the one.
And that a lot of times comes along and get all blended into some other things with the endocrine system. Your thyroid might actually, and some people have what's called metabolic syndrome. And a lot of these people, unfortunately, they gain weight over time, and the weight itself causes the diabetes to be worse. And that's a whole physiological reason why that happens. But it causes the diabetes to be worse, the more weight gain that you have. And so as an independent variable in your health, you want to actually try to get to a healthier weight. And that's going to be helpful in many ways. It's going to control your blood pressure better. Your diabetes is going to be better by just managing the weight. And how do you manage weight? The primary way to manage your weight is what you eat. And so that's going to be
and it's not just about men when it comes to diabetes and high blood pressure. It's women too, because it affects them just the same.
100%, 100%.
You know, Leo, it's not all the time we want to eggs up into an argument. You could just leave us out of that.
Unfortunately, yeah, this is one of those things that actually plague. You might not have a prostate, but you definitely can have diabetes and hypertension. It affects, and let me tell you, the one of the things that is important is that, you know, most women in the household end up being the person who makes a lot of the healthcare decisions.
Yes,
and so what I find in many women of childbearing age and older is that they place the health of the children and their spouse above them. And that is the one thing you can't do. If you're not around, you can't help the other people. So you have to take care of yourself.
Well, you know, Dr. Pyke, I probably want to take a little shot. I think that we're at a stage now where it's a wholesale approach. So if husband need to be eating vegetable, everybody will eat vegetable in the house, so that you cultivate a system of supporting each other through these kind of challenges. So yes, I hope that the woman really and truly not being mindful of the others and ignoring their own lifestyles. I hope not.
Yeah. Doc, that's very important. There's one thing that we didn't talk about. I'm gonna get back to prostate. With most men that I know in Jamaica, or not in Jamaica, but that are Jamaicans, one of their fear with doing the digital test is the whole thing of LBGTQ thing. That's this is the whole gay thing that comes up into their minds, because they, you know, that part of them is only for one thing, and they don't want to be touched that way and so forth. And you know, my ex-wife said to me one time, it's because they might have feel a good sensation and they might not like it. I don't want to like it. So, but anyway, but talk to that a little bit.
You know, I think that in all honesty, that's one of the things I find irrational to a certain degree. I think that, you know, men have to actually own to the seriousness of this and not actually divert it to anything else. This is a really serious matter, and I think that you know, talking about and bringing into it the conversation with homosexuality is actually just unfortunate, because this is about your health, and physicians are not out there trying to actually instill pleasure or pain or anything like that. You know, it's a serious thing, and unfortunately, right now, and you know, maybe in 10 years it changes, in 20 years or whatever, but right now that's the best test that we have to actually examine the prostate. We don't have a better way of doing it, and so I want men to actually stand up and really take care of themselves. You know, it's your responsibility. And in fact, one of the things that I try to encourage my patients is understanding how to love themselves. And this might sound touchy-feely and that kind of stuff, but I want them to embrace just a healthy self. And a healthy self means mind, body, and spirit, right? And so you want to make sure you embrace that in its totality, because it's one time you walk this earth that I know of, and you want to walk it good. You know, so if you're gonna do that, don't make excuses about this and that and stuff. You know, and stop living your life for somebody else. You know, own your health, take control of your health. Go and see a doctor. If you don't like that one, go find another doctor. If you don't like that one, find another doctor. But don't make excuses, because at the end of the day, it's on you. It's on you. It's your responsibility to take care of yourself. And what I don't like to hear is when people start to actually, you know, point fingers to everybody else of why this happened to them. You know, and that's just it.
And Doc, what's the name of the specialist who take care of that part of the men's health?
Urologist.
Urologist. Okay.
However, urologist urologist is just one person towards that specifically takes care of that, but your primary care will be able to adequately diagnose and even treat a lot of the things that about male prostate and other health issues.
Mm.
Okay. All right, and then the last question. This is all from me now and from my experience.
And your friend.
Friend. Oh yeah. Okay.
Forget, says him friend.
When I was like 20, 25, 30, and I would go to the doctor, right? You would get a list. I still get it. You'll get a list of all the things that are possibly happening to you, right? And you must put a check mark, yes or no, to all the things that are happening to you, or if it's not. And you know, when I was younger, I was just go down the list. No. You know, but nowadays I have to take a look at it a little bit clearer. You know, I have to say, hold on, you know, which one of these apply to me? But we should not take that lightly, because there is where you start the conversation with your doctor, isn't it? Right?
That is absolutely so. And let me tell you, sometimes what you're doing there is, so you have to be the person who owns what happened to you more than anybody else, correct? And so that is your time when you're actually doing that intake, yes, to actually go down the list and really be purposeful and understand. Because when they ask questions about something that about your grandparents or your parents,
yes,
it's that time to actually think about it, mm-hmm, and say, you know, yes, you know what, my mother's mother did have this. And so I wonder if this is now predisposing me to having this kind of stuff. Mm-hmm. And it's a time to think about it and be very truthful in your answers. Yeah. You want to actually put it down on paper. And then, by the way, don't let the doctor gloss over it, because let me be clear about one thing. Not all doctors are made equal. Okay. I teach medical students and medical residents and other people in training, and I've been doing it for many years. And the one thing that I can tell you is that some of the folks who come through, I even ask them a question, why are you here? Because I can see from the way they're actually there at that young stage that they lack empathy and compassion. And, you know, all of people who can pass exams. Yeah. And I firmly believe that, you know, almost any child can be a doctor, engineer, whatever they want to be. Yeah. But is what, you know, your mind is wired towards one or the other. But you can do it. So that's not the issue. Mm-hmm. A good doctor is a caring individual. Yeah. And that's at the heart of it all. And so if you're with a doctor who is marginalizing your symptoms, who is not listening to you, and you go back month after month after month, going and actually paying this individual, it's on you. You have to take responsibility and find somebody and force that individual to see you, not you as a patient, but see you as an individual, and make sure you explain to them. Don't let them rush you through the room, okay? Because make sure you demand their attention. And so in that intake that you're doing, be mindful of what you're writing down. Take notes yourself. Keep your own file. Make sure you understand why you're taking any single medicine. And every single time you go back to your doctor, ask the doctor, do I still need to take this? My mother was amazing at this. She would go, and I mean, my mother, you know, obviously, she have 3 kids who are doctors. So before she even got to the doctor, she'd corner all 3 of us individually, not together. And she would ask us questions about it. And she'd do this, and she asks questions. And so when she goes to the doctors invariably ask her, are you a doctor? You know, because she has 3 doctors who are actually telling her stuff already, and she'd go back with that information. And, you know, but you have to question that, because you have to be your #1 advocate. Yes. You can't wait for somebody else to actually tell you this stuff. You own your health, and you need to actually never outsource that to nobody else. And so you educate yourself about yourself and make sure you ask the right questions. Because at the end of the day, say the doctor misdiagnosed you, and a lot of times they misdiagnose is because the patient themselves did not disclose everything.
Yes.
And so you sue the doctor. Okay, so you sue the doctor, but you still have a problem.
You have a problem, right?
You still have a problem.
Yes.
So because a lot of times we define it, we look at life through the wrong lens.
Yes,
you know, you might cause that doctor discomfort by taking that doctor through litigation, but you still have a problem. And so you want to be upfront, proactive about your own health. That is a primary thing you have to be, you know, so get out of soapbox.
Whoa.
Hey, get some comments first before we wrap with
well, I might have lost some of them. Their comments about very informative show. Thank you, Dr. Pyke. Very educational, Dr. P. Keisha says, Leo, what happened to something? I don't know what that word is. Yes, you can even get urinary tract infection from holding your urine. There must have been some comment about people holding their urine and whether or not that would affect you.
Hey, say that again. Explain that, Doc.
Yeah, so actually, so when you remember, it's an open system, right? So you just like urine comes out, things can actually enter. And so the urine in the bladder, if it's held for a long time, it can actually get infected. And that can be a really tough thing. And so obviously women, because of their anatomy, they do tend to get urinary tract infections more often than men. But males get urinary tract infection likewise, especially when they're not emptying their bladder adequately. So very important. And that's sometimes one of the presenting symptoms is that they present with an infection, and then we have to actually investigate why. And as you go down that path, you find other things out.
Okay. Go ahead, Dan.
Homosexuality has been around for decades. Why is it that now everything is associated as such? You can't even hug anymore. What if every time us women go for a pap smear with a male doctor, is that sexual abuse? And it's just in response to how men regard the digital examination, that they have to endure. But let me tell you, Dr. Pyke, I thank you so much for sharing with us about this challenge that men face, but as wives and as mothers and aunts and all of that, as educators, it's important for us to have a full understanding and to be able to encourage those men around us to start their examinations early, and to not figure that every time that they can't get it up is a problem, and start taking these little pills. Because I am told that at a very young age now, men are popping the blue pills or whatever pill it is that they're popping. It is going to cause them a problem, if not now, in the near future. And we need to be able to encourage them against it, you know.
And I think our wives and girlfriends have to be a bit caring too, because sometimes.
No, well, I'm going to object to that totally.
We get
because Leo, fix that statement. I think that
right, let me fix it. Fix the
statement.
A lot of men out there are afraid of what the women will say or think, right? And that's one of the reasons that they probably will not talk to the woman about it. And so I should have said, I'd like our women to be a little bit more understanding to when they approach this delicate matter with men, especially if they know they're men are like that. Because it can have a serious effect on their relationship, and that's a withdrawal. That you cannot help me. Just want me getting in more trouble, but it can be that reason that men pull themselves away and cause a little bit more problems in a relationship. That's what I think.
All right, so I'll tell you this. I'll speak not just as a doctor, but as a male, and I'll tell you this. Yeah, certainly, communication is really important, obviously, and I think that I'll go to it. Yes, if you find a unique situation, certain women might not be as supportive as they should be, and not as caring as they should be. But there's a whole layering of factors that have nothing to do with the man taking care of themselves.
Yeah, I agree.
And I think that at the end of the day, that, you know, we have to actually be our own best advocates, and we really have to take care of ourselves. But I think that the days of you know, of women dragging the man to the doctor that for the man to take care of himself should be long gone. You know what I mean? I think that as men, as fathers, as brothers, we have to actually encourage each other, by the way. So a lot of times we spend so much time as men, and women have their own things that are not positive necessarily sometimes that they talk about, but men have this thing where you talk about everything else, football and cricket, and for me, golf, and you talk about this and domino and whatever. And we don't spend enough time talking about other things, about, in all honesty, you call other guys nerds and whatever, but you know, when we actually go through this world, and I kind of mentioned it earlier, your mind, your body, your spirit. So your mind, you want to cultivate a healthy mind. You want to, as men, we want to learn. Some of us don't like to read, so listen to Audible. Do whatever you want, you can, to learn about the world within which you live. Your spirit, you live in this world, and we are a spiritual being. And I'm not saying whether you're a Christian or a Rastaman or a Buddhist or whatever, but you want to explore your own spirituality, but then also your body speaks to you, and you want to actually respond accordingly and listen to what your body is telling you. Because a lot of times, if you're gonna catch a cold or something like that, you have a scratchy throat, and you have a sore throat, and you start to cough. Those are symptoms. Same thing happens with the prostate. Same things happen. The other thing we didn't touch on, by the way, is that is your colon health. Your colon health is really, because colorectal cancer is very pervasive among our people, and if the way we actually move our bowels is usually fairly consistent, and if you find that you're not moving your bowels in the way that you ought to, we do encourage everyone to get a colonoscopy by the age of 45, and then depending on what that result looks like, then you get it every 5 or 10 years thereafter, sometimes every 3 years even, depending on what's found. So you have to listen to your body, and as your body speaks to you about what is going on, respond to it. Don't wait for your spouse and put it on your spouse, your wife, to actually then pull you and say, come on, Harry, we have to go to the doctor. No, take care of yourself. You know,
you sitting can't turn up, me I left you. You sitting can't turn up, me I left you. Yeah.
No wife ever says that. No wife ever said that. That must be the matey out there. Keith Richardson says, thanks, Dr. Pyke, most informative. Leo, it's your life, and you should own it and take care of it.
It's your call this thing upon me now. Woman all ask me, what my friend name? What my friend name? What the hell is this?
I didn't go there. Communication goes hand in hand with caring, but I don't believe that a lot of us Jamaican women will just up and leave our men simply because there's an issue in the bedroom. It starts way before that. There's always been an issue communicating, or the individual perhaps figures that his sole contribution to the household is his sex, and that's the extent of his value in the relationship, and he needs to get past that. So we can,
Diana,
friend.
Wrap up first, Diana, and thank Doc for joining.
Dr. Pyke, I thank you so much for helping out Leo and his friend on the matter that he raised or that could not be raised. It was such a pleasure having you on here. Also, ladies have learned really how we can be far more supportive to our male family members, or husbands or brothers or uncles, that sort of thing. We've figured out how best to help them to treat with this matter. I'm really sorry that digital hasn't moved to a literal digital, but it's just simply a reflection of a digit that will continue to frighten mere man. Us women are always here to hold their hand and to get them through it. I thank you so much for sharing your knowledge, your competence so calmly and so easily with us. You made it easy for us. Thank you so much. And listeners, thank you so much for joining us. It's, as always, it's a pleasure. I have learned so much. I feel like I could be a real doctor now, Leo. Thank
Doc,
you.
you have a minute. Wrap up, Doc. Anything you want to say to them, to the listeners?
You know, I think as a Jamaican man myself, I'm proud and of my heritage, and I just want to encourage my Jamaican men to actually just, you know, love themselves. And when you love yourself, it will come right through, and to everybody else. You love yourself and you love your people around you, but you have to take care of yourself first, you know, and so you can take care of everybody else around you. Not defined by your sexuality, not defined by how much money you have or how you can actually, you're defined by so much. So don't limit yourself and limit your value. And all of us fall into that sometimes, but we have to actually pull ourselves out and encourage each other out of it.
Okay. Yeah, thank you. Thank you, ladies and gentlemen, for being here tonight. Thank you. We'll see you Saturday morning again. And Doc can join us at any time, and talk about anything we want to. Thank you so much for being here.
Three last comments. Just to provoke Leo. Dana, he says, Dana, you were great tonight. Poor Leo and his friend. And that Leo could be my first patient. Good night. Thank you so much.